Welcome to Master Meersa. Today's topic is osteoporosis. Let's start. Firstly, see the definition that is. Osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases, or when the structure and strength of bone changes. This can lead to a decrease in bone strength that can increase the risk of fractures. It is also a health condition that weakens bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a fall or sudden impact causes a bone to break, or we can say a fracture. It is a silent disease because you typically do not have symptoms and you may not even know you have the disease until you break a bone. Osteoporosis is the major cause of fractures in postmenopausal women and in older men. Fractures can occur in any bone, but happen most often in bones of the hip, vertebrae in the spine and wrist. We'll talk later about menopause and postmenopause. Osteoporosis can occur at any age, although the risk for developing the disease increases as you get older. For many women, the disease begins to develop a year or two before menopause. Well, see, osteoporosis is more common in female than male. In this, the density of bones decreases, which we can say the decrease in mineral composition. Let's make a mind graph of osteoporosis in females. Let's consider 4 stages of females' life: birth, puberty, menopause, and postmenopause. Aside this and understand the word menopause. Menopause is the time that marks the end of menstrual cycles. It's diagnosed after a female have gone 12 months without a menstrual period. Due to loss of ovarian follicular function, this means that the ovaries stop releasing eggs for fertilization. It lasts for rest of life of a female. Most women experience menopause between ages 40 and 58 now. The time after menopause is called postmenopause, and the time period before menopause is called perimenopause. I hope you understand all this regarding. Now in the mind graph, puberty, we can write menarche. Menarche is the first menstrual period in a female adolescent. Menarche typically occurs between the ages of 10 and 16. Menopause, that is last menstrual cycle. Now from puberty to menopause, the level of estrogen increases in female's body, but after that, during postmenopause, the level of estrogen decreases. Now decrease in estrogen increases bone-breaking activity, or osteoclastic activity, which cause decrease in minerals, by which it makes pores in the bones. That's why bone weakness increases, which can increase chances of fracture. Because more women get osteoporosis than men, many men think they are not at risk for the disease. However, both older men and women from all backgrounds are at risk for osteoporosis. When a child or teen develops osteoporosis, the condition is known as juvenile osteoporosis. Osteoporosis is called a silent disease because there are typically no symptoms until a bone is broken. Symptoms of vertebral spine fracture include severe back pain, loss of height, or spine malformations such as a stooped or hunched posture, kyphosis. Bones affected by osteoporosis may become so fragile that fractures occur spontaneously or as the result of minor falls, such as a fall from standing height that would not normally cause a break in a healthy bone. Normal stresses such as bending, lifting, or even coughing. However, breaks can also happen in other bones, such as in the arm or pelvis. Sometimes a cough or sneeze can cause a broken rib or the partial collapse of one of the bones of the spine. Osteoporosis is not usually painful until a bone is broken, but broken bones in the spine are a common cause of long-term pain. Although a broken bone is often the first sign of osteoporosis, some older people develop the characteristic stooped, bent forward posture. It happens when the bones in the spine have broken, making it difficult to support the weight of the body. Bone loss before osteoporosis, osteopenia. The stage before osteoporosis is called osteopenia. This is when a bone density scan shows you have lower bone density than the average for your age, but not low enough to be classed as osteoporosis. Osteopenia does not always lead to osteoporosis. It depends on many factors. Women also lose bone rapidly in the first few years after the menopause. Women are more at risk of osteoporosis than men, particularly if the menopause begins early, before the age of 45, or they've had their ovaries removed. However, osteoporosis can also affect men, younger women, and children. Many other factors can also increase the risk of developing osteoporosis, including taking high-dose steroid tablets for more than 3 months, other medical conditions, such as inflammatory conditions, hormone-related conditions, or malabsorption problems, a family history of osteoporosis, particularly a hip fracture in a parent, long-term use of certain medicines that can affect bone strength or hormone levels, such as anti-estrogen tablets that many women take after breast cancer. Having a low body mass index, heavy drinking and smoking, calcium is in high demand during both pregnancy and breastfeeding, since it is needed to support the baby's growth and development in the mother's womb and after birth. We hope you got all the segments just told by Master Meersa. If you understood this, then join us for other videos regarding human biological disorders. Whether you're a biology enthusiast, student, or just curious about the mechanisms of life, our videos cover a wide range of topics, from molecular biology and particular disorders and beyond. Join us on this educational adventure. Thank you, goodbye.